Just wanted to explain a little bit about what the pulsed electromagnetic therapy is doing for osteoporosis, how it works. This is the electromagnetic field generator. We set up the program, and it's very dependent on the frequency the pulse electromagnetic field is going on and off, and the power in Gauss units. So we've set those with what the research shows is most effective for osteoporosis, which is 45 hertz frequency and 40 Gauss units. This is the table the patient lays on. These are electromagnetic solenoids that circle the patient 360 degrees. The pulse electromagnetic field is not affected by the table, so it's going into the spine and hips completely in 360 degrees. And we can position these. Typically we'll do this first one over the lumbar spine and lower thoracic spine, which has a tendency to get osteoporosis, and cover the rest of the lumbar spine and the hip joints with these. And we can vary these in an exceptionally tall patient to make sure we get the spine adequately. We have these additional solenoids that we can place on the hip joints like this when they're on the table, so that we cover them the full length. The other application with these, we'll put another pair of these over the tibial bones where there's a lot of bone marrow, try to stimulate stem cells to mobilize and turn into osteoblasts, the cells that produce bone. We can do special circumstances with this. One of the big problems now is osteoporosis of the jaw in implant dentistry, where the implants do not take effectively. They fail because the bone is not strong enough. So we can move this all the way up over, including covering the jaw and the spine, and then use the two sets of these mobile solenoids to do the hips and do the tibia to mobilize some stem cells. So it's a very diverse piece of equipment set up specifically for osteoporosis, and that is just one of the state-of-the-art treatments for people looking for non-drug therapy.